Okay, thank you all for joining our online meeting on doing a degree in public health or global health, in which we will hear from 4 amazing scholars that will share their experience in doing various different degrees at various different universities. But before we start, I quickly wanted to introduce you to Students for Global Health Cambridge. So this is part of our weekly Saturday meetings. And Students for Global Health is a local part of Students for Global Health United Kingdom, which is a student organization focusing on global health and trying to ensure that we work towards a fair and just world in which equity in health is a reality for all. Sounds very idealistic, but in Cambridge, we do that by working on a various of different projects. So we have different subcommittees working on, for example, sexual and reproductive health, but also setting up a World Health Organization simulation committee. It was actually founded in 2018, but next to that, this is part of a really huge network of medical students all over the world. So we're about 1.5 million worldwide that you're connected with if you're part of this organization. So that is just a very brief introduction to Students for Global Health itself. Then as for this meeting, we have a few housekeeping things. So this webinar will be recorded. If you have a problem with that, I would suggest you leave the meeting again and maybe watch the recording afterwards. Slides will also be shared with members of Students for Global Health. And please make sure that you mute yourself during the talks, and we remain questions till the end. So you can post any questions that you have during the talks already in the chat function, but we will go over them at the end. If you want to engage on Twitter with us, that is absolutely fine. We have all our information here. And if you want to engage specifically with our amazing speakers, then you can find their Twitter hashtags here as well. So today we will be joined by Zahra, Laura, Samuel, and Rosie, who with their degrees at Johns Hopkins, the London School of Hygiene and Tropical Medicine, Cambridge, and Maastricht. So without further ado, we can start this meeting with Zahra, who will be talking about her experience at Johns Hopkins and her career as a medical doctor and active in global health as well.
Thank you, Kim. So hello, everyone. Thank you for joining and spending this weekend with us. I'm really grateful to Kim and Students for Global Health Cambridge for this invitation, and I'm really excited to join you today. I'll be speaking briefly about my experience as a medical doctor turned public health professional, and how my path took me there, and more specifically about Johns Hopkins School of Public Health, where I received my Master of Public Health degree. So as I said, I'm a medical doctor from Iran, and quite in the second half of my curriculum, which takes almost 7 years in Iran, I got more and more interested in public health as a discipline that I wanted to pursue. And for the med students out there, it's a really tough decision to decide whether you want to abandon your clinical practice altogether or not. But I eventually came to that decision, not out of despise for clinical medicine, but a stronger passion for public health. So let me just share with you some very basic slides that I prepared. Okay, yeah. So to give you a bit of background, during my student years as a medical student in Tehran, we started what became the Iranian Medical Students Association with a few of my colleagues and friends, which is a national member organization of the IFMSA, similar to Students for Global Health, or formerly known as Medicine. Eventually, I wanted to get more involved with other NMOs and other countries active in IFMSA. So I was elected as the regional director for the Eastern Mediterranean region of IFMSA for 2014-2015. Subsequently, I did an internship at the WHO with the Health Workforce Department, which was my main area of focus and interest in, global health research. Through IFMSA, I did an elective in Gothenburg, Sweden, in the surgical emergency department. Upon graduation, I immediately left to go to Baltimore, USA, for my Master of Public Health degree at the Bloomberg School of Public Health, which was an intense 11-month degree, which I'll get into more detail later on. But my MPH culminated with an internship with JPIGO, which is an NGO affiliated with Johns Hopkins, where they work on a really wide range of issues in various countries. Due to different circumstances, my internship was conducted on site, and I worked with them on human resources for health, initiatives, mainly in some African countries where I conducted some research on their data and presented it to JPIGO. I then left for Oslo, Norway to work with the EAT Foundation as a policy officer. EAT is a nonprofit that works at the intersection of climate health and human health through food systems, which was an invaluable experience for me professionally. I'm currently based in Berlin, Germany, where I work as a managing director for a biotech startup. Quite a different role, but given that it's a startup, it's allowing me to get exposed to a lot of experiences and opportunities that otherwise wouldn't have been possible this early on in my career. But I'm still, since graduation from Hopkins in 2018, my work with them is ongoing, and I'm still working with my mentor there as a researcher, working on various types of research outputs, such as book chapters and opinion pieces and journal articles. Since summer 2019, I'm happy to announce that I joined the initiative called Global Health 50/50 that's based in UCL London. It's an initiative that assesses global health organizations in terms of how much they commit to gender equity, both in terms of policies and practices of the programs that they do in, wherever that they're working, but also in terms of their leadership and board composition. When I joined, we were preparing the 2020 report that was just published in March. And we kind of brought in an intersectionality lens, which is my expertise, to kind of look at these organizations, not just based on how they're doing on gender, but bringing in different social stratifiers. So one interesting finding was, for instance, that there are as many Harvard-educated chairs of global health organizations in the world as there are women from low and middle income countries. So there are stark discrepancies both in how we operate global health and in health equity, and that's kind of where I'm really interested in focusing my work on. I was recently brought in to contribute to a Lancet series on racism and xenophobia, and I'm continuing to work with the Gender Equity Hub of the Health Workforce Department of the WHO to chair their intersectionality working group. And as with many other IFMSA alumni, I'm part of the Junior Doctors Network of the World Medical Association. I won't go into much more detail because each person's path is quite unique, and I'd like to, as a proud alumni, talk more about the School of Public Health at Johns Hopkins and the variety of opportunities that they offer. So Hopkins was founded, the School of Public Health at Hopkins was founded in 1918 and 1917 actually. It's been ranked the first school of public health in at least the US for 25, 26 consecutive years. It's the largest school of public health in the world, with hundreds of faculty members, over 90 degree programs being offered, and over 1,800 courses offered, which sounds really exciting, but makes it really difficult to choose and pick your courses once you're there, because you kind of want to take everything, but you obviously can't. So speaking of the degrees that Hopkins offers, there's the infamous Master of Public Health degree, which is an 11-month course. They do offer somewhat the similar curriculum, but for a different audience in their Master of Sciences in Public Health degree. They have Master of Health Administration, Bioethics, even a Master of Arts in Public Health. They do also offer doctoral degrees, including a PhD and a DRPH, and then an exciting range of combined programs, such as the MPH MBA degree that I initially applied for and got into, but then decided to leave out the MBA component as I did not feel like it aligned with my career goals. But there's really an exciting range of things you can do with the degree that you choose to do there at Hopkins. And these slides are just screenshots of their website, which is more helpful on the website with the hyperlinks. Hopkins also offers certificate programs, which instead of taking a degree program, you can take a certificate on a specific issue or a specific topic, such as the ones that you can see on the left hand, like global health, human rights, public health advocacy. And these are usually at least 12 credits or up to 15, 16 credits. The challenging aspect of it is that you have to pay by credit, so it's not the most cost effective, but I mean, if somebody else is providing, that would be really exciting. Once you're doing a degree program, you can also do certificates, so you can pick and choose your courses so that you graduate not only with your degree program, but with one or a few certificates as well. Then in terms of the departments, so there's a variety of departments that operate within Hopkins. The one that I did most of my courses with and my research with is the International Health Department, which I've heard that if it were a school of public health on its own, it would be the 4th biggest in US. So it's just, it accommodates a really wide range of interests that you would have, and you'd be able to find an expert who's working on it, and you can learn from. There's also population, family, reproductive health, mental health, health policy, epi and biostat, environmental health, and biochemistry and immunology as well. So when it comes to the MPH degree, it's offered in 2 different formats, the full-time and the online or part-time. I took the full-time format myself. It's a residential program, meaning that you have to be on campus for the duration of the 11 months that the course is offered. The course is designed in 5 terms, each term consisting of 8 weeks, and then you have 1 month of winter break in between, but then otherwise you don't have any breaks, so it's really intense. The full-time program accepts students that have a few years of work experience, either relevant or, if irrelevant, kind of tying it to how they want to make it work with public health. In lieu of work experience, they do take medical students or medical doctors who have taken longer to finish their studies. If you can't fulfill that work experience, you can do the Master of Science in Public Health. So a lot of college graduates from within US chose to do that instead of going for work experience and then coming to the MPH. With the online program, it's designed to accommodate people who are keeping on working full-time. So they can fulfill it within 2 to 3 years instead of 11 months. Most of the courses are offered online. There's only a very short period of time that's going to happen on site, and that's subject to change as well. But for both courses, both formats, full-time and part-time, half of the courses that are offered or have to be taken are core courses from the curriculum that you need to fulfill in order to graduate. And then for the other half, there are electives from that over 1,800 courses that are offered that you can pick and choose to either concentrate or customize your program. So once you start doing the MPH, there's, I think, at least 12, am I running out of time?
Yes, Zahra, if you can wrap it up in 1-2 minutes, then...
I'm wrapping it up in a minute, thank you. Sure. So once you do the MPH, there's at least 12 concentrations that you can do. So there's health policy or epibiostat. And with the concentrations, you have the advantage of having most of your curriculum designed for you, so you know what you want to do and what courses. There's obviously some variety in terms of what electives you can take. But it's kind of predetermined, and it's really fascinating. Or you can do customizing, which is, for instance, I initially wanted to concentrate, but I did not feel like any of the concentrations fulfilled the variety of courses that I want to take. So I did customize my studies. The school is incredibly supportive of both. And I think the one last thing that's worth mentioning is that each year's class, at least prior to this COVID pandemic, took around 230 to 250 students for the full-time program. And that's it. I'll leave the rest to the Q&A. Thank you.
Thank you so much, Zahra. It was very enlightening. Like Zahra said, if you have any questions, we will be keeping that to the end. Feel free to add anything to the chat already. But now I would like to give the hand over to Laura.
Thank you so much. Nice to see so many of you. I'm just going to share my screen as well. So yes, I'm Laura. I'm a medical student from Germany, and I intercalated a master's in public health at the London School of Hygiene and Tropical Medicine. I'm now back to my final year of medical school, so kind of working in the hospital. I'm doing quite a bit of other public and global health things at the side. So I just finished a WHO internship in the AMR division in April, and I'm working quite a bit in the areas of climate change and health. I'm at the German Climate Change and Health Alliance. I'm also working on gender equity in global health with women in global health. And I'm working quite a bit on global health education and how we can improve that in a national as well as in an international context, also working with IFMSA. But talking a bit more about the masters, maybe one question that always came up into my mind was there is those public health masters and there is global health masters, and then the London School is actually a Masters of Science in Public Health, and then there is Masters of Public Health, and if there is actually differences between all of those. And what I figured out so far is that it really depends on how the courses are set up. So like, don't be discouraged by the name of the program, but look more into what it actually offers. I would say that my public health masters actually had quite a lot of global health components. So it's like, it can actually be kind of the same depending on how the school is naming it. So if you're interested in any of those, just check out however they are named, because those can be older names or whatever. So yeah, just to check out all of this. As I said, I intercalated a master's, which I think in the UK is quite a common thing to do for medical students. In Germany, it's not. So for me, it was a bit like everything was kind of new, kind of surprising that it even worked. I didn't know that it actually worked at so many universities in the UK. So I didn't apply to any other but London school, and luckily I was accepted. So I left Germany after my 4th year of medical school to go to London and do that master's. What you can see here is a picture of the London School of Hygiene and Tropical Medicine main building. That is actually the super beautiful building in like surrounded by a lot of other schools of University of London. It's kind of old building that has those names of relevant public health people on the wall, and also kind of a lot of insects and disease vectors. So it's quite a specific building already. What I can say that in the last year, they also added the names of a few women after there was like a lot of public pressure. Before that was not the case, because like the only woman they could think of was Florence Nightingale, and they decided that her name would be too long to be put on the wall. But now luckily we can find her there. Talking a bit more about the program. So actually most of the things you can find on the website, and they are quite well explained. So if you're interested, I would recommend you to just go on the website and see like what exactly it offers. I don't know which prices the school has won, which programs they offer. So there is the public health masters, but there is many other things as well. There is quite specific things, and there is programs that are shared with other universities, like a global mental health masters, and just many different opportunities. So I recommend to go on the website and check it out. And I'm focusing a bit more on the public health program now. So how it works is there is this public health program, which has around 150 students. And this is the biggest course at the school. So the school only offers masters, no bachelor degrees, and only masters that are somehow related to the public health field. So it's quite a small school, which has about 500 students or something as a whole. It's quite a familiar place. It's really nice because it's so small and you get to know the other people really quickly. It has 2 small buildings and is really specialized. So those are things that I personally really enjoyed. The year is separated in 3 terms, and then for the public health program, you actually choose 1 out of 6 streams that you want to engage with a bit closer. And according to the stream, you're initially also put into a tutor group. So in the picture, you can see my tutor group, which was environment and health. But there is a lot of other streams that you can choose. And if you're like a bit unsure about things, there is a general stream as well, where you have a lot of options later on. And this is also true. You have a lot of options in general to choose different courses, to go more into statistics, to go more into social science courses, to go more into health topics, or to go more into skills-based classes. And basically, the whole master's is organized around you, and you can fit it as you like it. So what are the advantages of taking public health masters at LSHTM? most of all, it's like really learning from and with amazing people from all over the world. I think it's about 50% of the students that are not from the UK, and is really a place to make great friends. And I put you this picture that is just from last week. It's from like all my LSHTM friends, and we are like regularly meeting for this book club during the pandemic. So it's really super fun, and you have the chance of meeting great people there. Second, it's exchanging thoughts with people from different disciplines. This is really easy because the classes that you can choose of, the all other masters can also choose. So you will have classes with people that study One Health, that study epidemiology, that study nutrition, and it's really fun because you learn a lot more than just public health, and you get to learn to know a lot of people from different backgrounds and disciplines, and that's, I think, a really big advantage. Then I already said you can really fit the program to your interests. You can choose a lot. You can change your opinion. And then you can also obviously choose a research project for your thesis that should be a bit according to your stream, but I think there is a lot of flexibilities to that as well. And then fourth, there is a lot of academic opportunities of courses and events, and it's nearly every day, really, that there is something going on, either in the lunch break or in the afternoon, where they really have great people that come, like really famous global public health people that come for presentations, for discussions, for whatever you like them. And this is really a place where also outside of your classes, you can learn a lot of public health and really engage in that topic. Also, you can discover a lot of new topics for you, and then ideally already connect with the research centers. So for me, how it happened, for example, I ended up in the environment and health tutor group because I had an interest mainly in urban health and urban environments. And turned out that like most other people in the environment and health group were actually doing climate change. So then I started also engaging a lot more with climate change than I was doing before, when I was mostly looking into urban health. And now I ended up doing a lot more climate change than before. So I think that really like gives you the chance of getting in touch with new areas and new fields that you might have not discovered before. As I said, it's quite a small school, but that has the advantage that you can approach nearly everyone who studies or who works there, and like exchange ideas, talk to them. Like the researchers that work there, like everyone, the teachers, they are usually really open to just meet for a coffee, to just have a chat, to work with you. So like that is really a great environment to do that. Other thing that you're definitely going to learn is to distinguish between Jon Snow and Jon Snow. So because one is from, as you might know, Game of Thrones, and the other one is a really famous British epidemiologist that has drawn that famous map that you can see here on the slide. And if for now you don't really know who is who, then I recommend going to LSHTM, and I'm pretty sure you're going to be sure about that by the first day. Otherwise, you can also just visit the Jon Snow pump handle bar in Soho, and you can also learn about that. Living in London for me was also amazing. I mean, for most of you might not be super exciting because you're already living in the UK. But I really enjoyed it because out of LSHTM, there is also all the other universities that offer great things. There is a lot of other opportunities. So this is also great. Then I come to how to enjoy it best. I think if you want to study public health, you should be open for new people and new thoughts, and try out all the things you're interested in. So try not to be like best in your degree, and like to just take courses that are easy for you and that you know you get good marks, but maybe just try out new skills and and try to get as much out for you as possible. Stay after class for events, and usually the events come with snacks and wine, so it really is worth it. Connect with researchers and the other students. It really makes a great community of like-minded people that you're going to benefit with for the rest of your career and your life. And then discover the school and the places around. So I personally really love libraries, and Health HGM has the great one that you can see here on the bottom, but only a few minutes walk away there is the Welcome Collection reading room, which is also amazing, and there is so many other nice places. If you don't like reading so much, you can do everything else you ever wanted in London as well. So we did as a tutor group activity, for example, this sunrise yoga. So yeah, there is something for everyone, and try to not only focus on your degree, but also what is going on in the world around you. So yeah, I think studying public health is really about connecting different perspectives and views. That's my last slide, and
Perfect. Thank you.
And I think it's really an opportunity to get all excited about how broad health can be, and exchange your thoughts with like-minded people that you might not find at your medical school or in your undergrad degree. So you can try out different and maybe new skills, and also have the chance to critically reflect your own point of view with regard to many things. So I really recommend all of you to think about studying public or global health, and then enjoy all the opportunities that you have. And that's my last slide.
Thank you so much, Laura. Just a reminder, if you have any questions for Laura, you can already add them to the chat, or otherwise keep them till the end. Now we will turn over to Sam.
Hi, everyone. I'm Sammy. Hold on, let me just get this ready. Whoops. So yeah, just to tell you a bit about myself, I'm a medical doctor. Actually just graduated from medical school last week here in New York City. And yeah, so I'll just be talking about, sort of my path in public health and global health, and just sort of like the degree programs that I did, and, some pros and cons and what I got from it. And hopefully you'll get some more questions in during the Q&A. So just to tell you a bit about myself, so I'm originally from Ethiopia. I also grew up in Zimbabwe and the Congo before moving to the US. I didn't fall too far from the tree. Both my parents work for the World Health Organization, which is probably why I ended up going to public health subconsciously. So yeah, I think that's part of the reason why I tried to pursue an undergrad in public health, because I was really interested in trying to get involved from an early age. So I did my public health degree at Hopkins, partly because it was, at the time when I applied, it was one of only like maybe 3 or 4 schools in the US that offered an undergraduate degree in public health. I did my MPhil in epidemiology at University of Cambridge just a couple of years ago, and my MD at the Icahn School of Medicine at Mount Sinai here in New York City. So currently, I'm about to start as a resident physician at Albert Einstein College of Medicine, which is, a medical school / hospital here in the Bronx, New York City. And in the future, I see myself working as a clinician, but also, really focusing on working in public health, hopefully in like an NGO or international organization. And just a disclaimer, even though everyone on this panel is in medicine, you do not need medicine to go into public health. By its very nature, public health and global health are interdisciplinary fields. Medicine is obviously included in that, but a whole bunch of other fields are included in that. So by no means do you need to be a medical doctor to be able to do important public health work. Again, I think and I think that was partly the reason why I was motivated to go into public health, because of the multidisciplinary approach that it uses. And I also appreciate the preventative focus. You're taking an upstream approach rather than, treating people that are like right in front of you. You're trying to figure out, what are the factors, societal factors, neighborhood level factors, policies that are contributing to a person's health and bringing them here to you today. And I felt like, it was a tangible way to be part of efforts to help the communities that I want to help and be involved in. And beyond medicine, you're working at a population level. So your impact is that much greater, rather than strictly working at sort of an individual level. So my experience at Hopkins, I know my colleague already spoke a lot about it, but I'll just talk very briefly about my own experience. So as I mentioned, I did an undergraduate degree there. Undergraduate degrees in the US are about 4 years. I imagine, many of you are already either in undergrad or looking to do a master's program, so likely not relevant to you. So I'll just talk more about just sort of, just the experience of being at Hopkins. So the School of Public Health, as my colleague mentioned, is, the largest school of public health in the US, and I'm pretty sure the world too. It's really just hard to say, or hard to describe just how massive it is. There are just so many different degree programs that are available to you, lots of different, faculty that are working in many different projects. I think they have close to they have projects working in close to 100 different countries around the world. And you have a lot of opportunities to have, to be funded to go work there, depending on the master's or, degree program that you end up picking if you end up going there. So my situation, I did 3 years of undergraduate classes, and your 4th year you do, you basically take any of the graduate level classes that are available, 1,800 plus classes. And you can tailor your own, sort of track. So I ended up doing a weird morphed version of biostats and policy and management. So a bunch of very different varied classes that I ended up taking my 4th year. So yeah, I would say the best way to describe Hopkins is that it's big. You have a lot of opportunities, but of course a con of that is that, it's kind of easy to get lost in the number of master's and PhD students that are doing stuff there. It's not to say that it'll be hard for you to find a mentor, but it's definitely going to take some legwork on your end to be able to do it, because not everyone is going to know your face, But again, lots of different opportunities. I think honestly second to none, when comparing to opportunities that the School of Public Health offers. So at Cambridge, definitely a different flavor. So the degree program at Cambridge is run through the Department of Public Health and Primary Care. They technically offer 3 degree programs, but the ones that are relevant to this talk are the MPhil in Public Health and MPhil in Epidemiology. Both of them are 10-month long programs. I actually ended up coming in on the Public Health MPhil program, but switched halfway through to the dismay of my public health colleagues. But but that's not to say the public health degree program is not a good program at all. It's just given my interests, which I'll talk a little bit about. So the first term, so Cambridge has 3 terms. First term, for both degree programs, everyone is in the same class. It's about 30 something odd people in both degree programs combined. And you basically take just just introductory courses in biostatistics and epidemiology. Second term and third term is sort of when the divergence happens. Public health students focus more on, environmental health, health policy, health economics, behavior change, things like that. While epi students end up, taking more advanced epidemiology and biostatistics courses, in addition to, taking a whole host of modules, basically. So you have an infectious disease module, genetic epidemiology, chronic disease, etc. And I should also mention the department itself is a bit more chronic disease focused. So the curriculum itself, it's not that you won't get anything outside of that, you will, but you have a lot of chronic disease experts that work at Cambridge. So that if that's an interest of yours, I think this is the place to go. So I think, just to summarize the experience at Cambridge, I think Cambridge is, in comparison to Hopkins, it's a smaller department, which is, great in a lot of ways because everyone knows your face there. you get a lot of interaction with your like people that you're basically in the same room for like 10 months, like in these classes. So you get to know people like really well. It's very diverse. You get people from all around the world that end up taking this course. But again, I think a con of it is that, again, you may not necessarily have all of the same opportunities that you have at Hopkins. That's one thing. And, I think a con of this module-based sort of like method, at Hopkins, you get to pick a track. So let's say if you're like super interested in like infectious disease epi, you can just like take all of your classes, elective classes in that. At Cambridge, it's just like you take everything. So second and third term, you're taking all of these classes. So, which is great in that like you get a broad overview of like all of these different fields. But a con of it is that it's a bit superficial. So you'll know like just sort of like the basics of it. But you won't necessarily go super in depth unless you end up working on that in your thesis. And just another thing to mention with the thesis project too, you don't necessarily have to like, it doesn't necessarily have to be like chronic disease focused or like within the expertise of the people that you work with. I ended up doing mine on intimate partner violence, which, is not necessarily something that people focus on in the department, but you can definitely do it. It's just more legwork on your end to do that. How am I doing on time, by the way, Kim?
You have a few 2 minutes left, maybe something like that.
Okay, yeah, I'll be done in like a minute.
That's
Don't
great.
hold me to it. So what I've gained, I think just through both experiences at Hopkins and Cambridge, you get a lot of practical skills. Critical appraisal, which is really important, trying to determine whether is this a good study, how was it conducted, being able to like really rip apart a paper, you'll definitely get that experience of both. Biostats and epidemiology knowledge, use of statistical software. Another thing is also the network. You get to work with like very interesting people from a lot of different backgrounds, both medical and non-medical, and also work with like a lot of different faculty, which I think is great if you're looking for a career in public health or global health. In my particular situation, as I said, it's not a prerequisite to go into clinical medicine. Just working in medicine when you're like trying to figure out how best to treat someone, you need to be able to be up to date on the literature and be able to like really go through it. And I think you get a lot of skills through that if you are in medicine. And I think with the current pandemic too, I think there's a lot of need right now for public health professionals. I think there really is no better time to really like jump into this field because of what's going on with the current global pandemic. So yeah, hopefully that sheds some insight. Yeah, that's basically it. And I'll leave that to the Q&A.
Thank you so much, Sam. Then we're last speaker already, which is Rosie. I've been writing all your questions down in the meantime, so don't worry, we will get to those at the end. I'm handing over to Rosie now.
Hi guys, thanks for joining. It's great to see so many people and really inspiring talks. I'll just share my slide. So I'm from Canada, but I'm currently doing the Master of Global Health program in the Netherlands. So as part of, okay, there we go. Can you see the slides? Yeah.
Yes.
Okay, thanks. Yeah, so I'm with Master University, Master of Global Health, and as part of that, I'm currently in India. So my background, my education is, I'm in final year of medicine in Galway in Ireland. As part of that, I went to Switzerland for an exchange with Lausanne. And then, at the moment I'm in Manipal, Academy of Higher Education, as part of this master's. I'm a board member of the Irish Global Health Network for the past few years. That's like our national body for global health advocacy and research. Then, yeah, I've kind of always had an interest in global public health since I joined medicine in 2014. So I've done some internships over my summer breaks. So you can see there Cedar, that's in Cambridge. I spent the summer there. And I also went to Leuven to do biomedical ethics, Uganda, WHO Europe in Copenhagen. Unisante is in Switzerland. It's like a public health and primary care center for marginalized populations. And then last summer I was in London next to the London school where Laura was at the Wellcome Trust Science Media Center. And then in my spare time, I've been volunteering. So I was the National Public Health Officer for IFMSA. And I've been involved with UAMs for the past like 5 years, which is advocating for global access to medicines and diagnostics. And then at the moment, I'm researching with Zahra in Genève, which is a center for humanitarian research and education. So as part of that, I'm doing some work on coronavirus and also with evidence aid for refugee collection of systematic reviews. So that's a bit about me. I'll tell you about the course now. It's just a 12-month course from September to August. The first month is quite intense. Some people, actually a lot of people made fun of me for going out of medicine for a year to do global health because they think it's so easy, but it was much tougher than medicine in some ways. So it's quite full load in the first semester. You have foundations of global health, advanced methodology and statistics with SPSS, and qualitative research skills. Actually, they have quite an emphasis on qualitative, which was nice. And then my favorite course was governing in global health. So you have to do a lot of reading each week. And then you have weekly problem-based learning tutorials to discuss all the readings. So governing gave you a really nice historic background and current snapshot of how global health is governed, because it's such a complex field. And then there's also a module on new biosciences. So part of it is about like epigenetics and quite biochemical studies, and then part of it is more social science. So it's a really nice mix. And because the course is with people who aren't in medicine, it's some of it's easy, but the social stuff was definitely new for me. Then in second semester, there's more methodology and statistics. Foundations of Global Health is an online course with both semesters, actually. It's an online course with students from Sudan, India, and Canada, McMaster University. So you're put in a team and you have to do assignments virtually. And then you get to pick an elective, just like in the Master of Public Health degrees, you can pick a track that you're most interested in. So I chose infectious disease epidemiology and public health, so that's why I'm in India for that. And then at the end of the Masters, you're promised a 2-week symposium where all the partner universities come together, and there's about, I think, 500, 600 students from Sudan, Thailand, Canada, Netherlands. And you present your thesis proposal, you do some system mapping, but of course this year it was cancelled, so we had a full virtual symposium for 2 weeks. And then after all that, you get 4 months to write your thesis. It's quite rushed. The electives that are offered are described here. You can find all the information on the website, but we don't know with the pandemic if they're possible anymore. So what I like about the course, it was designed by a qualitative researcher, Anja, who is a Dutch lady, and she's a really interesting person. She developed the course 10 years ago, and she developed it because she went to a very small island for her PhD, where she realized this no white saviors perspective, where you know, you can't help everyone just because you're white, just because you have money. So the whole course is based around that, and being ethical, doing ethical research, having local communities heard. So there's a huge focus on that, which I liked, and all of the lecturers are very much so about this. So it's really nice. It's not like old-fashioned international health thinking. It's very modern and global. And then they also use a health system strengthening perspective. They really teach you that you can't solve any global health issue unless you approach the whole health system and whole of government. So that was great as well. And then of course the students are great. It's about a group of over 100, quite a lot dropped out this year for various reasons, but I think there was about 120 at the moment. They're from all over the world. There's definitely scholarships offered for people from lower and middle income countries, and a lot of Europeans, because in Maastricht it's very cheap to study. I think the course is €2,000 if you're European. That was partly why I did it. And yeah, they're all quite young. I'd say the average age of our batch this year is 24 or something. And then, yes, like I said, the lecturers are very well-spoken, very much into research. Some are medical, some are law, but it's a great mix of features. And the problem-based learning approach is really cool because you get a lot of time in a room with the professors and maximum 8 students each week. So it's quite nice. And then the best part is that we have a coordinator who finds thesis options throughout the year, and by the end of the first semester there's over 100 options to choose from of where you can write your thesis. So it's great that she helps, because I know some global health courses, they don't help you at all to find your thesis placement, and it's a lot of stress. So this way you really get a lot of choice of what you can do for your thesis, and they also help match you to your supervisors. Just some final points of advice. Try to get some field experience before you do your master's, because there's no point in going into a very theoretical master's without having some background experience. So if you're medical, it's fine, you have hospital experience. But if you're coming from a different background, it's definitely good to get some sort of internship or volunteering experience that is ethical and nothing above your knowledge. Also pick a master's based on what you're interested in within the course. Don't pick it based on where it is, because you'll be studying most of the time anyways. So it doesn't matter where you are, just pick one with the best content that suits you. And network. So global health is such a small world. So I think I met Laura and Kim in conferences, and it's really cool to build a nice group of colleagues from all over the world. Just connect with them on LinkedIn or Twitter, and you'll see that you'll bump into each other a lot. And remember to take time for yourself, because you can't help others if you can't take care of yourself. And I learned that this year for sure. So that's the website, and this is our student ambassador. You can find her on Instagram. Thanks so much.
Thank you so much, Rosie. Thank you for all of you who stayed till the end. We will now open for questions. So we already got quite some questions in the meantime. So I will just remind you to be concise with the answers and the rest of the questions that people may add to the chat. So first, maybe Laura and Zahra could answer the questions in regard to the World Health Organization. So the questions that were asked were, how did you get the opportunity to do an internship at the World Health Organization? And do you have any advice to get such internship? For example, tips for interviews or what to focus on and how you represent yourself.
Yes, I'm happy to answer that because my internship was quite recent. And as you might know, WHO has gone through internal transformation, and they also restructured the internship program. So they basically try to kind of close the back doors to get an internship. So what you should do right now is you should go on the WHO website, and there you can find the internship program. So you need to log in and create a profile where you give your interest, and then you will be contacted according to the interest that you gave if there is opportunities, and then they will, and if you agree to like those offers, basically they will invite you usually for an interview or might ask you further questions or anything like that. It is quite complicated to get through this process, but yeah, that is basically how it works. Right now, because of the pandemic, they are not able to take on new interns. So if you're playing with the idea of doing that, you might need to wait a bit until the internship program is reopening, because I know that it's basically frozen for the moment. But yeah, so go on the website and there you can find all the information, or otherwise you might want to contact someone from the WHO intern board to help with that.
And a quick addition from my side, I was reading the chat box, and there are, apparently national programs that offer these, or did offer. I don't know about the transformation now, but coming from Iran, I did not have any of these networks that would enable me to do that. What I did was what Laura said. So I had signed up on the website waiting for updates to come. Some opportunities, came through the mailbox, but I didn't want to just do an internship for the sake of doing it, especially because I would have to fund it myself as well. So I wanted to wait for the right department, and that did not come through the mailbox. It did come through an opportunity announced on the NMO server of IFMSA. For an internship with the Health Workforce Department. So that's how I got to know that they have an opening. Interestingly enough, they had not, or at least at that time, advertise it on the internship portal or the website that Laura mentioned. So essentially, anyways, I signed up, and I went through the interview process that Laura mentioned. So you need to kind of know what you want, but you also need to prepare for it. And one personal reflection after that is that doing an internship with the WHO is not going to guarantee your success in global health or public health, or your entry into any of the prestigious schools. Actually, most of the people that I met at Hopkins, for instance, had not done that. Some of them went to do that afterwards. So don't think of an internship at the WHO as the golden key to your admission to the schools, because I know it's a privilege and it's not available to everybody. So don't think that if you can't do it, you're not going to get into the program of your choice.
Thank you very much, Zahra and Laura. And a very good point indeed at the end of Zahra, that it is not necessarily true that you need the World Health Organization internship. A lot of the people that I did my degree with also didn't have that. So then to go to another question, this question is most relevant to Sam and Zahra. So how do you think you can combine a career in public health with a clinical career? Or how do you combine it at the moment, if you already do that?
Yeah, I can definitely take this question. Honestly, it depends who you talk to. Some clinicians definitely feel like, there's no way you can combine both of them, because like you have to focus on one. But I have definitely met people that were able to do both, and I think the best setting to be able to do it is probably, an academic medical center. So if you're able to work, and obviously I'm just speaking within the context of the US because that's the context that I'm most familiar with. But yeah, there are definitely a lot of clinicians that work within these like big medical centers, like let's say here in New York City or like in Boston and Harvard, et cetera, that, work, as much as they want within a clinical context. You can do it full time and do public health part time. There are definitely people that practice part time, so like maybe 1 day a week, and then the rest of the time they do this. There are even like options within hospitals where they have schedules where it's like you work 2 weeks on and then you get 2 weeks off. So what people end up doing, you can either take a vacation for the next 2 weeks, or you can use that time to actually, work on projects that you're interested in, consult for like NGOs or, the World Health Organization, things like that. So I think the nice thing about a career in medicine is that if it is something that you want to do, there's a lot of flexibility for you to be able to do it. I don't know how that's going to change with the current pandemic, but at least up until now, that has been the scenario. Hopefully that was helpful.
Great, thank you, Sam. It seems like a common theme is we don't really know how things are going to change during this pandemic. But to go to the next question, why and when do you think a master's degree was necessary for your career? Was it purely for the learning experience, or was there a very specific reason that you choose to do this master's degree?
Okay, I can go first. So I did approach the master's degree mainly for the academic and learning experience. I wanted to pursue public health and global health as my, career, and medical school definitely did not equip me with the knowledge necessary for that, maybe just with the basics. So I was, educated in human health, but not public health. I could have gone for a PhD, but I think that wouldn't have given me the variety of courses that I was able to take and the substantial knowledge. So that's my kind of advice to people going into public health. If they don't have a strong background, public health is a strong discipline, and it's not some fuzzy ideas out there, and you need to be academically trained in order to be kind of helpful to the society, but also because for me, I'm very used to looking at the profiles of people that I look up to, and a lot of them coming from medical backgrounds, but other backgrounds as well, had MPH degrees that enabled them to take on public health roles, and that's why I chose these specific
Sorry, very quickly, there's someone not muted, and I can't mute the person for some reason. Can you make sure that you're all muted? Yes, thank you. Okay, thank you, Sarah. Did you want to add anything to that, or?
No, it's fine. I'm done. Thank you.
Does one of the other panelists want to add something?
I'll just say I did a master's global health because I really wanted to learn research skills properly, and in medicine I felt I didn't have that enough. So now I feel a bit more confident doing research, and I think it's nice to have that early on in your career.
Yeah, I would definitely say for me, as I mentioned, I was interested in public health even before I did my undergraduate degree. But I knew that, while I was in medical school, like I did want to do a master's, and I felt like for the timing for me, it made more sense to do it while I was still in school rather than later on down the line. Because let's be honest, life can happen and things might get in the way in the future. So I ended up taking a year off in medical school. So medical school in the US, it's usually you do 4 years of undergrad and then 4 years of medical school. It's sort of like treated as like a doctorate, like PhD degree. So I took a year off after my third year to do a master's in public health for that reason. And partly another reason too was I just needed a break from medicine for a little while. And I felt like it was a nice way just to do public health for a little bit, because it's something that I really care about and I love doing. So.
Okay, thank you so much, Sam. For the sake of time, we will move to the next question. So Laura, a more specific question for you. How do you view against the comparison between the London School of Hygiene and Tropical Medicine compared to schools that seem to be more prestigious in the UK, like Cambridge and Oxford? Do you have any opinion on that?
Okay, like I mean, we are here in the, like a chat with like all Cambridge students, right? So I don't want to say anything wrong. No, so to be honest, as I'm not usually in the UK university or academic system, that was not my main concern when I studied my master's. I think, yes, in general, Oxford and Cambridge might be the most renowned schools. However, London School of Hygiene and Tropical Medicine is a very renowned place for studying public health specifically. So there I would think it is really like with John Hopkins, like one of the very like most famous schools to study public health. So it's just very small and very specialized on that specific field. So that's why people outside of the field usually don't really know it. But in public health, I think it is really as well known, if not even more than Oxford and Cambridge.
Yeah, I just want to add to that too. I feel like because I went to Cambridge, I can pick on Cambridge. Yeah, no, I'll definitely say the London School is like world renowned, basically. It's definitely like at the same level as Hopkins, for sure. Cambridge and Oxford obviously have like the brand value. So like if for someone outside of public health, as she mentioned, they'll probably know that more than the London School. But like within public health, London School is like a very, very prestigious institution.
I would also personally like to add to that a lot of the different public health schools have different types of expertise. So in Cambridge, for example, the expertise is more focused on healthy diet and physical activity, and you're more really focused on the UK. While in the London School, there is more focus on infectious diseases, for example. So do really look into that as well. If you have a very particular interest, go on the website and check whether your school of interest is specialized on that. Then on to the next questions. So do any of you have any advice for networking? I think Rosie mentioned that at the end of her presentation, so maybe you can give some advice, Rosie.
Well, yeah, it's hard with the pandemic, but LinkedIn is great. And Twitter is really cool, actually. I've only started using that this year, but it's really nice. Networking. Well, once you build a few contacts, it's pretty easy to just branch out, and email is always good. So say you're doing a research project, just contact one person that you know who's an expert in that field and ask them for contacts, and they're really normally happy to give you some.
Yeah, maybe just to add to anything what Rosie just said, I really recommend to not get too stressed about networking. I personally don't really like that term to start with. I think if you go at a school and you study something you're really motivated about and you're really enthusiastic about, it's really easy to find people that have the same interests, that have the same motivations as you, to get in touch with them, and they are going to be your network. And it's more like finding friends and like finding people you like to exchange ideas with. And then I think it already sounds a lot friendlier than networking. That is a really, for me, a really technical term. So I recommend to not getting stressed about it. It's something that kind of happens by itself.
Okay, do Sarah or Sam want to comment on that, or shall we go to the next question?
Just very quickly, as Rosie mentioned, Twitter, I think, I don't know about other disciplines, but I think for public health, it's just a gold mine right now. There are so many of the older scholars that are on it and are doing really well on Twitter, and you can engage with them and you can learn from them. And you can have an equal conversation with them as well. My own experience joining Global Health 50/50 came from Twitter. I got to know of them on Twitter. I approached them on Twitter, and kind of everything happened after that. So don't underestimate social media, I would say.
Yeah, and just like a brief thing to add, obviously you won't be able to do it just because of the pandemic that's going on now, but at some point it will end. So I think conferences are a great way to network. So, I mean, you don't even necessarily have to have like a project to present. You can just go to a conference, and usually you'll meet a lot of like very like-minded people, and you'll be able to like exchange contacts in that way. So just something to keep in mind in the future, hopefully near future.
Thank you so much. That's very helpful. Then another question in regard to funding, because obviously a lot of these masters cost a lot of money. I think the Maastricht University one is probably the cheapest out of all of these masters. But how did you fund this? Or do you have any tips on how you can fund it?
Yeah, I already said I had a scholarship for that. To fund that, because in Germany as well, studying is free. So here we don't pay, and then going to the UK obviously is a huge change, not yet comparable to the US, but still expensive enough. There is a lot of scholarship opportunities that you can look into depending on like the country that you're from and the schools you're going to. So I recommend definitely to do this.
Yeah, and yeah, just to add to that, so at Cambridge, I was on a scholarship while I was there, but yeah, I think the best way is, usually a lot of these universities have specific like funding schemes depending on like where you're from. So it's literally, just a matter of like making sure you've exhausted all of your options in that regard, going through the website, trying to find other outside like funding bodies that may be able to fund it. So it's just honestly like a matter of like trying to be as resourceful as possible. I won't speak to Hopkins necessarily because I didn't do the master's there. But of course, education is very expensive in the US, as many people know, quite the opposite from Germany. But again, it's a lot of these institutions offer scholarships, financial aid and funding. So it's just, just making sure that you've exhausted every possible source to be able to do that.
Rosie or Zahra, want to comment on that, or are we happy with the answers of Laura and Sam? Just to note as well, there are a few global health degrees in Europe that are free. So for example, in the University of Copenhagen, if you are a European student, then you can go study for free at Copenhagen. So that's just a small note. Then a specific question about how many people in public health masters have a medicine or similar degree. I don't know if any one of you knows an exact number, but maybe you want to comment on it?
I can let you know, and let me just share my screen for one moment for this. So this is actually the information that Hopkins provides. It's an average of what happened over the past few years. So half of the class are physicians and med students. Med students are the Americans. Physicians are usually the international ones who have already graduated. There's a small percentage, like around 10%, that are other healthcare professionals, but then the majority, like 40%, are coming from different disciplines, including research management. In our class, which was really interesting and valuable for me to connect with them, there was one high school biology teacher, and there was a journalist from South Africa. So there's a wide range of backgrounds. I think it's just important to kind of find that piece of the chain that connects your background to public health. But other than that, I mean, it's not something that if a class is mainly from medical doctors and medical students, that the course, at least to my experience, kind of changes, because where we come in with our strong biology and physiology background, we lack other types of, disciplines of knowledge, and structure is always so collaborative that you get the chance to learn the things that you don't know and learn from the people who are quite different from you in terms of their background.
Yes, maybe just to add on that, it also depends a bit on the school and the program. I know that in LSHGM there is quite a few people having a medical background, and then there is other global health or public health programs that are a bit more maybe social science based, whereas you'll find a lot more people that have another background. So it depends a bit for really what you're looking, like which skills you're looking at as well. Usually it's the case that if it's a bit less epidemiology but more social science, then you find a bit less doctors.
Any other person that wants to comment on that, or?
Yeah, I'll just say anecdotally in my MPhil program, public health /epi at Cambridge, I would probably say like it's definitely less than 50% of the class were somehow like medicine related. I was the only medical student just because I guess it's not a thing to take a year off or intercalate to do a master's within that program, but yeah, I would probably say it's definitely less than 50%. The vast majority are coming from either like public health backgrounds or like, straight out of undergrad, or maybe worked a few years in some context. So yeah.
Thank you so much. Then one of the last questions, do you have any advice for getting remote experience in global health, public health? This person that was asking this indicated that their studentship was cancelled, and probably this is the case for a lot of other people. So they're looking for opportunities to engage in this current time.
I mean, I think there was never a better time to engage in global health virtually than now, because everything is online. So there is kind of at least 5 global health webinars happening every day. So if you're interested in a specific topic, you can learn so much right now. There is a lot of open online courses that you can do if you want to practice specific skills or like inform yourself on a specific topic, and that's an option. There is a lot of conferences that are now also happening online, and it is surely not the same as when it's in person, but it's maybe one first step to get more engaged and to learn more about what you're interested in. So I think it's might actually be a good time to learn more and to see more that would usually be in person and not be open to everyone, that is now more available.
Yeah, I would suggest making a post on LinkedIn or Twitter and just saying you're a student with extra time during this pandemic and you'd like to help out some way with research or contact tracing. And there's actually a lot of institutions who would really appreciate the help at a local or international level. So that's what I did, and I got this project with Sarah in Geneva, and also Evident Aid takes interns from abroad. So I would just suggest looking for places like that. You can email me as well.
Do Sarah or Sam want to comment on that, or want to move to the next question? No? Okay, great. Then in regard to Twitter, do you have any people or accounts that you highly recommend to follow? If you have to name 2, which are the top accounts that you should definitely follow if you are in global health?
Richard Horton from The Lancet.
But then after Richard Horton, Jocelyn Clark, one of the senior editors of The Lancet that covers issues around gender.
I would say Dr. Tedros. I'm not being biased at all because he's also Ethiopian, but it's fine.
Sorry, I'm just going to shamelessly plug something because somebody in the chat box also mentioned the Twitter account for Global Health Now. Global Health Now is the daily newsletter from Johns Hopkins, and not because I'm from Hopkins, but it's an incredible daily resource on news, on variety of articles, and they do, introduce interesting Twitter accounts as well. So just Google Global Health Now and sign up somewhere on their website to receive the daily newsletter in your inbox. And now they're doing a fantastic job of covering, anything COVID related. And their Twitter is not as active as their actual newsletter. So do the newsletter.
Laura, did you want to say something, or?
I was not prepared for that question. I don't know, there is so many, but if you start following some of them, you will see that they also like going to retweet others. So then you can just like build up your network slowly. I think Ilona Kickbush is also tweeting quite a lot if you want to follow her. And yeah, otherwise, I don't know, really like start with them and then, oh yeah, that is true. Matthew Pai is also really good. You can also follow the schools that are sometimes helpful. Yeah, I don't know if Rosie has anyone else to recommend.
We may make a list with some recommendations and post it on our Facebook if that's helpful. But now in the meantime, there are some people listed in the chat. Then I have one question left that is very specifically for Laura. Can you elaborate on your experience with climate change and health and what kind of projects you are engaging in?
Yeah, so as I said, I'm working with the German Climate Change and Health Alliance, so that is something kind of country specific, but in a lot of countries there actually is like something similar to that. So organizations that are focused on climate change and health, and usually they are very happy for everyone who is contacting them and like trying to help out with things. I'm also working with IFMSA on that, and YANGO, which is the youth constituency of the UNFCCC. They also have a mailing list, so you can just join that and see what young people are doing in the climate change world. Also, this is not very health specific, but IFMSA is doing quite a lot on that. Might be a good starting point. Yeah, me specifically, I'm also working on quite a bit of research with Kim actually on climate change, health, and gender, which we do for Women in Global Health and other organizations. So yeah, there is, well, the climate change and health world is quite a small one, but usually they are very open and very welcoming for everyone who's interested. So maybe check out in your country what is there as a national organization, or check with the big student organizations.
Thank you so much for that, Laura. Are there any other questions left? If not, then we are kind of moving to the end. Maybe if there's one last message that everyone of the panel can give before we end, then we can move to an ending. Sarah, do you want to go with the last message for the group?
Sure. Well, thank you for your time and interest in listening to us. I think public health is incredibly, and global health, they're incredibly interdisciplinary. And while there are so many different ways to get inspired and people to look up to, what I've seen around me is that people usually forge their own path, and kind of each person's background and then what they seek is quite unique. So don't be afraid to kind of go for what you're interested in. And even if you don't become a full-on public health practitioner, it's a really great set of skills and tools that allows you to bring in an equity and justice lens in the actual work that you do full-time. We're available on Twitter. Well, I'll speak on my behalf. I'm available on Twitter if you have questions, and that's it. Thank you for your time.
Thank you so much, Sarah. Sam, do you have any last comments?
Sure, yeah. I think just to echo what Zahra said, this is like the time to go into public health, I feel like. Just given what's going on with the pandemic globally. I mean, I can just speak for New York City. I mean, things are a lot better now, but I mean, just a month ago, just how bad things were. And it was honestly like public health interventions that like stopped what was before a very out of control, epidemic that was going on in the city. So I think, there's a high need, and a great time to go into it. And obviously I'm happy to answer any questions or concerns that you have, either on Twitter or like, through my email that I'm sure Kim will provide you. So yeah, thanks again for coming.
Thank you so much, Sam. Rosie, do you have some last words you want to add?
Yeah, just don't go into global health for money, don't go into it for fame. Try to do it because you want to help people.
That's a very important message. Thank you, Rosie. Laura?
Yeah, I don't think I have much to add. Thank you for everyone. Thank you to everyone for attending. And I think public health is a lot of fun. So it's really nice to reflect on many issues that maybe you haven't seen from that many different perspectives before. And you're probably going to learn that everything is a lot more complicated than you just thought. But yeah, I think that is the fun part of it.
Thank you so much, all of you, for joining. If you want to get involved with Students for Global Health, feel free to reach out to us through Facebook or per email. You can find the Twitter handles and emails of our panelists in the chat. And that was it. Have a good evening.
Thanks so much.